Afternoon. My name is John James, and I'm the Director of Public Health and Disaster Services at the Palm Beach County Medical Society. And as always, I appreciate the opportunity to speak with you all. A little bit about me. I was born and raised right here in Palm Beach County. I went to Atlantic High School many years ago. I left there to attend the University of Florida, where I earned my degree in economics. I began my professional career at the Home Depot, where I was in management for 12 years. I left there, I spent a few years with Cemex, which is a construction company. I then decided to go back to school to get my master's in health administration at FAU University. And through that degree and an internship that followed, it helped me land the job that I'm currently in, which is the Director of Public Health and Disaster Services. So what does that role entail? In short, I work in the healthcare sector, but instead of providing direct care to patients, my impact is more communal. I oversee two programs that help strengthen the emergency preparedness efforts in Palm Beach County. One of those programs is called the Medical Reserve Corps, and they are volunteers, medical and non-medical, who want to assist during times of disasters. In fact, we have about a dozen nurses and doctors who are currently providing support at our vaccination sites. The other program is called the Healthcare Emergency Response Coalition, or HERC. What is HERC? It's a network of acute and subacute care hospitals, first responders, emergency management, the Department of Health, and many other partners who come together to plan, train, exercise, and respond to all public health and disaster events. What is a disaster? A disaster is an event that causes massive loss of life and or property. So we as a group, we come together, we plan, we train, we exercise, and then we identify gaps. Gaps are those things that didn't go so well during the exercise. So we try to fix those gaps, and then we complete that cycle all over again. And we do that with all types of hazards, whether it's a hurricane, an active shooter event, a pandemic. The idea is to, when a real world event occurs, we minimize loss of life and loss of property damage. So for example, back in 2014, our hospitals and fire rescue began preparing for the Ebola virus. Ebola is a highly infectious disease, and it has very high mortality rate. So it's critical to have sound protocols in place whenever you're treating an Ebola patient. So one of the takeaways from those preparedness efforts was the need for better PPE, or personal protective equipment. So in 2018, about 3 years ago, our coalition, HERC, we purchased and supplied each of our hospitals with this powered air purifying respirator, or PAPR is what we call it. And PAPRs, they protect the healthcare worker from all types of agents, chemical agents, nuclear agents, explosive device agents, radiological agents, biological agents. And they are being utilized throughout our county today, protecting our healthcare workers from COVID. In fact, Palm Beach County was one of the only few counties that had ample supply of these PAPRs during the COVID pandemic. So everything I just mentioned above would take place on a typical day, what we call blue skies. Let me pivot to gray skies. Gray skies is when the county is activated, and Palm Beach County has been activated for COVID-19 for 360 days. My role within this pandemic was first to provide situational awareness, and that entailed listening in on conference calls with the CDC, Health and Human Services, the Department of Health, and then sharing this information with all of our healthcare partners. Next, I would literally process hundreds of requests for supply: masks, gloves, gowns, face shields, you name it. I monitor the status of hospitals. Are they having surge issues? Are they having difficulty meeting their staffing? And I report this information to our county administration. And finally, and most recently, I began providing vaccination support to the community. So all of this is occurring in what we call gray skies. So I want to give you a couple of tips. And the first one has to do with active shooter events. So during an active shooter event, most of you, when you're in school, your school has protocols in place. You go into lockdown mode, et cetera, et cetera, et cetera. But what happens if you're at a concert, or you're at the mall, or you're eating? The one thing I want to impress upon you is you should always, always, always know your entrance and your exit points. Know how to get in and know how to get out. You also should always know your surroundings and pay attention to your surroundings. So you want to put your cell phone down just for a few minutes and just scan the room and keep an idea as to what's going on in wherever you're located at. If it's summertime and someone comes in and they're wearing heavy clothing, and let's say they're walking around and they're sweating, they're not giving eye contact, they have a backpack, they set it down, they leave. That's a suspicious activity. That's the kind of thing you want to respond to. You want to get up and leave, and you want to report it. It's called, if you see something, say something. And there's a number that you can call to report incidents like that, and they welcome it. And that number is 855-FLA-SAFE. Again, it's 855-FLA-SAFE. So let's shift to a different season. So what begins May 1st and goes through November 30th? You got it, hurricane season. And so during the month of May is when you want to start building your kits and making a plan. That's the time you want to start preparing for the oncoming hurricane season. And you're able to get a lot of hurricane preparedness efforts from the county's website, which is www.readypbc.gov. And this would also tell you if you live in an evacuation zone. Let's talk about when a storm is pending. Most people make their preparation arrangements based off of the cone, which is good, but the cone only tells you basically the anticipated path of the storm. There are several other maps that you should utilize when making your decisions. One of them will tell you how much rain to expect. Another one would tell you how much wind to expect. Those are impacts. The last one would tell you when you can expect to experience heavy rainfall and wind. And this information can be retrieved from the National Weather Service. So if you have a Twitter account, download the National Weather Service app or the National Hurricane Center app. Finally, salary. So what can you expect to make in this field? It really depends. If you're in the public sector starting out, probably 50 to 60,000 would be an entry level point. If you go into the private sector, it could be a little bit more. But the thing I wanted to really press upon you is if you love what you do, it won't feel like work. And if you love what you do, it won't feel like work. You will work harder at it because it comes natural to you and you enjoy it. And when you enjoy something, you get really, really good at it. And when you get really good at something, the money will follow. So with that, I want to wish you all the best in your studies and your journey.